Well, hi everyone. This is Deidre Kindred, your nurse advocate on Health Chats Among Friends. I'm so happy to be here tonight. My name is Deidre Kindred. I'm a nurse advocate, educator, and navigator. And what I love doing is bringing the reputable resources to the communities we serve. So tonight I am honored to have my friend Liia Harmon here with Dispatch Health. Leah, say hello.
Hello, how are you?
Oh, we are doing awesome. Awesome. I'm super excited to learn more about you and learn more about the services that you provide. So, start off with telling us who is Liia Harmon.
Well, I am Leah, and I have been in the Dallas Fort Worth area for all of my life. And I've been with Dispatch Health in the area for the last 2 years. And Dispatch Health has been around in this area for about 2.5 years. And I am the Fort Worth area market operations person.
Oh, awesome. So, okay, before we get into what is Dispatch Health, so you guys are in Dallas and other counties
We
as
are.
well?
We are. So
Oh,
we go by zip codes, and we are in most of the zip codes in Dallas, all the way through Fort Worth, all the way to Weatherford. We cover a lot
oh,
of area.
that's awesome to know. So, what is Dispatch Health?
So we are mobile acute care. So if you or a loved one is sick or injured, we actually come to you in the home instead of having to get out and about. Um, we come to you 365 days a year from 8 in the morning until 10 at night. And we can see anyone in your family over 3 months old,
Ooh, so 3 months up until
all the way, as
all
old
the
as you can
way.
get.
Yes, how high can you go? So I love it. I love it. So, so basically, you are like a mobile urgent care.
You might say a mobile urgent care. We can do everything you can do in an urgent care and then some, and most of what you can do actually in an ER too. Obviously, we can't perform surgery or admit to the hospital because we don't offer transport, but we bring it all to you.
Oh, that's awesome. Awesome.
Yeah.
So, tell me some more about the services you provide. Give me a hypothetical story.
Sure. So we come out and we can test and treat for the flu, UTI, strep throat. We can give you an IV while you're sitting there on your couch watching The Price is Right. We can write you a prescription to the pharmacy of your choice and then give you the first course of antibiotics right there on scene. So you're already on the mend. And then as we leave, we send all the notes over to your primary care physician. So your physician is part of the loop of care that you're getting. Your home health is in the loop, your doctor's in the loop, your family's in the loop, everything's all in place.
I absolutely love it. I love it. I love it because what if you are living alone?
Oh, for
And
sure.
right, that would
We
be
have
a
a lot of people out there who are either living alone or uh, they just can't get out and about, either because of illness or having a lot of kids at home or just don't drive anymore. And they need health care too. So they need someone to come to them.
that's awesome, awesome. So, some of the other services, just so we can make it clear for the audiences, sometimes I repeat myself just to make sure we get the point across. So, you're like a mobile urgent care and then some. I heard that and then some. So, and you service all areas Dallas, Fort Worth, Weatherford, and places like that. So, let's say that, do you guys do COVID testing by chance or no?
We do some COVID testing. That might end up backing down just a little as more and more people are vaccinated or have actually caught it and had it. So we are doing urgent care. We are doing mobile testing.
Okay,
So
awesome,
we
awesome.
always bill as urgent care, which is why I threw that in there. We're always billing as urgent care. So you're not ever getting that escalation of, sometimes when you go to an on-site urgent care, they can escalate it based on what's going on to an emergent care, which would be a higher level of pay. And we always bill as urgent care.
I'm so glad you brought that up because all urgent cares are not created equally,
They are not.
right? Right. So you have some of those that says emergency,
Mhm.
And then you have some of those that are urgent care. And then you have yours, of course, it's the mobile urgent care. So there's a difference in cost.
There definitely is. And sometimes some people who say urgent care or emergent care may offer both, and it just depends on the time of day that you go in.
Oh, wow.
Yeah, for
Okay.
sure. That's
Yeah.
kind of catchy right there. And I will
Hmm.
say we take nearly all commercial insurance and we take all Medicare, including the Advantage plans.
Ooh, that's good to know. That's good to know. So tell me about some of the people that are coming out in the dispatch vehicles. What are their
Sure.
credentials?
So when you have a team come out to you, you will get either a nurse practitioner or a physician's assistant, all licensed and board certified, and they come out with an EMT. There is always also a doctor on call should they have any need to escalate what's going on scene.
Awesome. Awesome. So, hot topic. What do you say to those people who say, well, I don't want a nurse practitioner, I want a physician?
Well, they are board certified and licensed. And when they come out to you, if for some reason there's another level of need, they can call and they can speak to um, a doctor on call. But I would say to you, a lot of times when you're going out to your doctor's office anyway, it's the nurse practitioner or physician's assistant who you're reaching out to anyway. They're usually very knowledgeable, and you're really getting a skilled professional who's coming out.
I am so glad we brought that up because, there has been a, kind of a divide. I don't know which one is, more or less, but I feel like I'm going to say this because I'm a nurse. The nurse practitioners are awesome that I've encountered. They're very thorough, very knowledgeable, and the physician assistants as well. So both of those are great resources. They're very knowledgeable. And I feel like sometimes, no offense to some of my physicians, that the nurse practitioners are more patient and more willing to listen a little bit longer. I will just say that from my own personal experience. Whenever I would take my mom to the doctor when she was here, I was like, when we get a nurse practitioner, I'm like, yes, because I know that he or she is going to take a little bit more time than the physician. So I just
No,
wanted
and
to
I
say
can't
that.
speak as to what the physician would do, but I will say
Right.
when they come out to you, um, you're getting someone in the home. So if you have, for example, a senior parent, an older parent, or even a college student who is over 18, and you you just don't know what's going on in the home all the time. And we go out and we can see, oh, this person is on these medications, this person's uh, walking areas are difficult for them to maneuver because they can't see it anymore. We're actually able to put our eyes on things that a physician's office isn't able to see
Oh,
just
yeah.
because they're not in the home.
Oh, yeah. Oh, yeah. So this service has been around how long did you say?
So we have been around since 2014 in Denver,
Okay.
Colorado, and we're all over the United States. We have been in the Dallas-Fort Worth area just since the end of 2018.
Okay, okay, got it. So that's why it's been a while because I was like, "Ooh, this is such a great service." When I met you, I was like thrown away by. I think it's a great service because sometimes you don't want to get in a car and go to an urgent care, even though they have implemented better check-in procedures. But at the same token, there's no place like home, right?
Oh, for sure. And I will say, here's a good story. I have actually used Dispatch Health for myself, um, my kids, my father. Um, I came back from Guatemala very sick. I had drank some water and was not feeling well. And I was not about to get up. I was not about to drive anywhere, and I was not about to sit in a waiting room. And I know how it feels when you're really sick. You can barely lift the remote to change the channel. You're just feeling not so well. You'd rather have someone come to you. It's much
Right.
easier. You order a pizza because you don't want to get out and about. Why not order your health care because you don't want to get out and about? You're still getting a great quality service without having to leave your house.
Absolutely. And I love the fact that you mentioned that you guys will notify their primary care physician. So, because they need to know anytime you fall or there's a change in your medical status, that's when it warrants a phone call to your primary care physician,
Oh,
right?
definitely.
Yes. So let's talk about a little bit about cost if you can. I know we talked a little bit about urgent care versus emergency outpatient facilities. So let's talk a little bit about your price range because I know somebody would have a question about that and the
Of
insurance, the
course.
coverage.
Let's do. Okay, so when you go to the emergency room, let's say you have a UTI, you go into the emergency room, you know that you're walking out of there spending several hundred, if not upwards of $1,000 to walk in the door and get tested. And when all is said and done, if they see another level of need and they keep testing, you can walk out of there spending a huge chunk of money.
Mm-hmm.
Whereas when you call Dispatch Health, we always bill as urgent care. So look at your insurance card. And on your insurance card, whatever it lists as your urgent care copay or however your co-insurance works, you may need to hit your deductible. Everyone's insurance is different, but take a look at your insurance and see what your copay is for your urgent care. You're looking at a significant cost savings, even if for some reason you need to be a cash patient and you have to pay out of pocket. The out-of-pocket rate is $275, and that's a flat rate. So, for example, if I had to come out and send a team and we went to your house and we gave you an IV, we wrote you a prescription, we did a good checkup of you, and you said, wait, I also have a rash. So we take a look at your rash and we just have to do all these different things. We test and treat for the flu, UTI, strep throat, any of those things that falls under that. um, it's still the 275. So you're,
Wow.
yeah, definitely getting a much better deal than if you were going into the hospital or calling 911.
Wow. That's excellent. That's excellent
It
because
is.
it's like almost like the movie Forrest Gump. Life is like a box of chocolates. You don't know what you're going to get when you walk into urgent
That's for
care.
sure. That is for sure.
Like, what am I going to walk in and walk out with? So at least
Exactly.
oh, that's wonderful.
Yeah.
That
The
is
only
so
time it
wonderful.
would be above and beyond that is if we
Hmm.
had to involve a third party. Like if we came out and we thought, oh, I think she may have fractured her wrist, and we have to call a mobile X-ray unit to come out, then of course they would send their charge for
Their
that.
bill. Oh,
But
okay,
yeah,
awesome. And you said you take most insurances. What
we
about
do.
any Medicaid by chance?
So we do take some Medicaid and we take AmeriGroup. Those you may have to call in and find out just to be specific on what we take. But definitely, if you have regular commercial insurance or Medicare, that's pretty much usually a go.
And you'd also mentioned that if they're private pay, they can pay out of pocket.
You can pay out of pocket, flat
Hmm.
rate of 275
That's awesome.
for sure.
I think that's awesome. If you think like maybe you're coming down with some symptoms of COVID or something or the flu or you just don't feel well, Dispatch Health is the way to go. I
For
just really think
sure.
so. So and I love that you work all around the metroplex and you're all over the United States you had mentioned.
We are. So when I first started with the company, I think we were only in like 10 metropolitan areas, and now we're in 30. And
Wow.
our plans of expansion are significant. We hope to provide services to people all over the United States who are just not able to, or just too sick to get out and about.
That's awesome. Oh my
Growing
goodness.
rapidly,
Mm-hmm. And so from you said 3 months on up.
3 months on up.
Wow, that's amazing. So in 24/7, 7 days a week?
Well, we are
Or
365 days a year, but we're 8 in the morning until 10 at night.
Okay, okay.
But
I'm
if
glad
you
I
call
asked.
after that, you can leave a message so that you can get care the next day.
Oh, okay, okay. So if it can wait, you would advise that, they can just come first thing in the morning.
For sure.
Would someone schedule an appointment at that time? Or how does
Yeah,
that work?
you would just schedule an appointment the next day. Yeah.
Oh, okay, okay. Especially now with our season of COVID, this is just an amazing service. I think because, for those people who are, you're not feeling well and you really don't want to get out and your primary care physician is probably backed up to the wazoo,
For sure.
and you don't want to wait and wait and just sit on top of something that could be taken care of with just a simple phone call to Dispatch Health. Come out, take a look at you, and get you some treatment.
And wouldn't you much rather wait in your living room? You can just keep your show on, keep watching what you were doing, keep sitting on your couch in your snuggie and wait for us instead of getting dressed and going into the doctor's office. It's a lot more convenient.
Absolutely. I just think it's a stress reducer, especially like hypothetically, a lot of my clients, their loved ones live out of state and
Mhm.
they live here.
Yeah.
And if you call mom or dad up and they just don't sound right, and 9 times out of 10, mom and dad are like, "Oh, honey, I'll be fine. There's nothing wrong with me." And then the next
Yeah.
thing you know, you talk to them next time and they sound like, "Woo, we need to get somebody out there, mom, dad, call Dispatch Health. Let them
Oh,
come
yeah,
out,
for
take a
sure.
look at you, and just for reassurance, because you never know, it could be urinary tract infection that you can nip in the bud instead of turning into something like full-blown sepsis, and that can happen. So it's best to just stay on top of it and call Dispatch Health. I
That's
love it.
right.
And so repeat to me again your hours. You said from 8 to
8 in the
10.
morning till 10 at night, but we're open 365 days a year. So even on Christmas, holidays, weekends, we're available. We're also a pretty good benefit for senior living communities and home health nurses. We can kind of help keep your patients and residents from having to get discharged onto out of your service, because we can come to the home, take care of them right there, give you the notes, and then be gone.
Yes, yes. I think this is amazing. I think all home health nurses should know about it just in case, and just kind of spread the word. So I'm so happy that you took the time out of your busy schedule to come and talk with me and educate the community. This is awesome.
Well, thank you. I appreciate the time you spent.
Oh, goodness. So if people wanted to learn more about Dispatch Health, where your um, area of service, or more about just some of the other services that you guys provide, what is the best way for them to get in touch with you?
So you can look us up online at dispatchhealth.com/DFW, or for help, you can either call the Dallas number at 214-377-1791, or for medical help in Fort Worth, you can call 817-435-1727. And if you just have questions in general and you'd like to reach out, or if you're with a home health company and you'd like to speak to someone about Dispatch Health and find out a little more, you can always reach out to me. And my email address is Liia, Liia .Harmon, HARMON, at dispatchhealth.com.
Awesome. And if you don't happen to remember that, you can always call me and I will be more than happy to get you in touch with this wonderful service. I think it's so valuable. Well, Liia, this has been awesome. I thank you again. If you have any parting words.
Don't put it off. If you're sick and you're not feeling well, go ahead and call someone and just at least have them come out, check you out, make sure you're doing okay.
That's great. Great parting words. Great parting words. Well, thank you again. My name is Deidre Kindred. This is Health Chats Among Friends, where we bring you reputable resources in our local communities. So, thank you again, everyone. Tune in next time for another amazing health talk. Thank you.
Thank you, Deidre.